Hello everyone. So in this video we are going through the applied aspect of the insulin and glucagon hormone. Diabetes mellitus, which is the syndrome of carbohydrate, fat and protein metabolism. Now which are the causes of the diabetes mellitus? Lack of insulin, that means insulin concentration is completely deficit inside the body, and decreased sensitivity of insulin receptors for the insulin, so there will be insulin resistance. So both are these conditions which can lead to the diabetes mellitus. Common predisposing factors, this includes the hereditary obesity, which is the main reason behind the development of insulin resistance. There will be decreased response of the receptors to the insulin and decreased number of receptors. So these both condition which ultimately leads to the diabetes mellitus. And stress, nowadays we are living a highly stressful life, so that is also one of the factor which can lead to the development of diabetes mellitus. Now the types of diabetes mellitus: type 1, which is known as insulin dependent diabetes mellitus, or it is also known as juvenile diabetes, which is due to lack of insulin secretion. That means when the pancreas beta cell is not working properly, and due to this there will be complete lack of secretion of the insulin, that is known as type 1 or insulin dependent diabetes mellitus, IDDM. Type 2, non-insulin dependent diabetes mellitus, and IDDM, which is the adult onset diabetes. That means mainly these type 2 diabetes mellitus seen or starting from the early adult life and continuously throughout the adult life, as well as till the death of a person. And what is the reason behind type 2 diabetes? There will be reduced sensitivity of the target tissue to the insulin, so that there will be development of the insulin resistance, and that is the main reason behind the type 2 diabetes mellitus. In both types there will be decrease in the uptake of the glucose. There will be decreased utilization of the glucose, and due to this there will be increase in the blood glucose levels, and due to this there will be increase in the utilization of fats and proteins. So here the understanding of the diabetes mellitus. Now here it is the glucose molecule, and glucose molecule is not able to enter inside the cell. So here glucose is not available for the cell to utilize and production of the energy. Hence there will be utilization of fats and proteins inside the cell for the energy generative purpose. So that is what the things happening in the diabetes mellitus. Now the type 1 diabetes mellitus, which is known as insulin dependent diabetes mellitus, which is due to lack of insulin secretion, which occurs mainly in the childhood. And the reason is that there will be injury or destruction of the pancreatic beta cells, and the cause may include the viral conditions or autoimmune disorders, or in some other condition it may be hereditary. That means the cause is unknown. Now the type 2 diabetes mellitus, that is non-insulin dependent diabetes mellitus, NIDDM. And you already know that although the insulin level is normal, but the insulin sensitivity or the insulin receptors are not working properly, so there will be development of insulin resistance, the more common than the type 1. So this condition of insulin resistance or the type 2 diabetes mellitus is more common than that of the type 1. It occurs mostly after the age of 30 years. Now which are the reasons behind the development of this type 2 diabetes mellitus? It may include the metabolic syndromes, for example genetic disorders in conditions of increased glucocorticoids as well as growth hormone. During the pregnancy, it is also the high chance of development of type 2 diabetes mellitus, which is known as gestational diabetes, polycystic ovary disease, autoantibodies to the insulin receptors. So that is also the reason. In some other condition, there will be mutations of the insulin receptors. So all these are the causes behind the development of type 2 diabetes mellitus. In the earlier phase of the type 2 diabetes mellitus, which is managed by medicines, but after some time and due to continuous hyperglycemic conditions the beta cells of the pancreas are not working properly and they are exhausted, and after this the person may need the insulin therapy. Type 2 diabetes mellitus associated with the hyperinsulinemia, compensatory to less sensitivity, obvious condition. Obesity, it is the main risk factor for the development of insulin resistance, and hence there will be development of type 2 diabetes mellitus. Insulin resistance, as I just mentioned. Fasting hyperglycemia, that means even if the person is not consuming the glucose normally, but still there is a conditions of hyperglycemia. Lipid abnormalities and hypertension and CVS disease, these are the complications of the type 2 non-insulin dependent diabetes mellitus. Now characteristic features of type 1 and type 2 diabetes mellitus. The onset age in type 1 usually less than 20 years, whereas in type 2 more than 30 years. Body mass, the person may be low to normal, and in type 2 the person is obese. Plasma insulin level in type 1 low or absent. In the initial condition of type 2 there will be normal level of insulin, but after some time it may be increased in the insulin level, plasma insulin level. In both the condition type 1 and type 2 plasma glucagon level is high, but the type 1 the glucagon level can be suppressed, but in type 2 there will be resistance to the suppression of the plasma glucagon level. Plasma glucose level increase in both the condition of type 1 and type 2 diabetes. In the type 1 insulin sensitivity is normal, whereas in type 2 there will be decreased sensitivity to the insulin, so the condition of insulin resistance will be there in the type 2. Therapy, insulin therapy is the only option in the type 1, whereas in the type 2 the therapy starting from the anti-diabetic drugs as well as weight loss, but after some years of the treatment of oral anti-diabetic drugs the person may require the insulin, or the insulin requirement will be the only treatment available after some years. Now the characteristic features of the diabetes mellitus, there will be increase in the blood sugar level. It's an obvious condition. Glycosuria, that means presence of glucose in the urine, and due to this there will be osmotic diuresis and loss of sodium along with the glucose. Extracellular and intracellular dehydration, decrease in the protein because proteins are utilized for the energy development and generation, so there will be weight loss and asthenia. Increased mobilization of fats, and hence there will be development of abnormal condition which is known as atherosclerosis. Tissue injury which leads to microangiopathy, hypertension, heart attack, kidney disease, retinopathy, neuropathy, stroke and dry gangrene. So all these are the damage which occurs due to tissue injury. Acidosis due to ketogenic effect, acidotic coma and death, these are the more severe outcome of the diabetes mellitus. Sign and symptoms of the diabetes mellitus: polyuria. Polyphagia occurs because there is a glucose monitoring system which is present in the hypothalamus is not working properly in the lack of insulin, and due to this the hypothalamic cell continuously feels that there is decrease in the glucose level, so that the ultimately the food intake is increased, so that is polyphagia. Polydipsia and polyuria. Polydipsia means increase in the water intake, and polyuria, that means increase in the urine formation and urine output, loss of weight, lack of energy, asthenia and susceptibility to the infection. So these all are the characteristic features of the diabetes mellitus. Now the diagnosis and treatment of the diabetes mellitus. Now we have to prescribe some common investigations. For example, fasting and postprandial blood glucose level. Postprandial, that means after meal we have to measure the blood glucose level. Normal blood sugar level fasting 60 to 100 milligram per dl, and after the meal there will be 100 to 140 milligram per dl, that is the normal blood sugar or glucose level. We have to find out the urine sugar whether it is present or not and its concentration. Glucose tolerant test should be performed. Glycosylated hemoglobin level we have to measure, and in this condition of the glycosylated hemoglobin specifically we have to prescribe the test which is HB. A1C. Treatment, which includes the exercise, diet restrictions, oral anti-diabetic drugs, and insulin.